And here is your stem.
Okay.
You have read and understood?
Yes.
Considering it communication skill station, please begin.
Okay. Okay. Hello, good morning.
Yes, good morning.
I am Dr. Abdul Gadir, Senior House Officer working for Mr. Man.
Yes.
I am talking to speak to Mr. X, who is a vascular consultant, to ask him to accept the referral of patient with critical limb ischemia. Could I check that I am calling to Mr. X, the vascular
Yes,
consultant?
speaking. Kindly summarize your case.
Thank you for your time, sir. A 54 years old female presented with abdominal pain diagnosed as mild diverticulitis. Her
Yes.
symptoms were improving on IV antibiotic and fluid, but now she's complaining of sudden left lower limb pain. On examination, the left lower limb pain appear paler, pulseless, with pain, and her investigation revealed arterial blood gas show metabolic acidosis and also she has ECG show atrial fibrillation and hypokalemia.
Right.
So yes.
So
I
why
suspect
do
the
you
patient.
think this
Yeah.
case is urgent? Can't you wait till tomorrow morning?
Yes, it is urgent. Unfortunately, I think the patient has a critical limb ischemia in which early intervention is needed for fear of losing the limb.
Okay, you've just told me that on ECG it shows atrial fibrillation and broad preventricular complexes. Don't you think you should be calling the cardiologist first?
No, I think this can be assessed later. Our priority now for saving the limb.
All right. So what are the differential diagnoses that you're considering for this patient?
Regarding the abdominal pain or the
Yes,
right lower
regarding the
limb?
abdominal pain, you said.
Yes, it could be due to mesenteric ischemia, especially in the view of acute limb ischemia and the atrial fibrillation. I have to consider mesenteric ischemia as one of the causes of this patient abdominal pain, or it may be due to perforated viscous, or it may be due to infective colitis.
Okay. So, but you said abdomen is soft, it's not tender. So why do you think that there could be mesenteric ischemia or perforated viscous?
Yes, the ECG show atrial fibrillation, which has a high risk for emboli shooting, and also the presence of acute limb ischemia also raise the susceptibility of mesenteric ischemia. Although the abdomen is soft now, I will do a series of abdominal examination, and if needed, I can go for CT with contrast after checking the renal function test of the patient.
All right, okay. Considering the acute limb ischemia, what might be your new diagnosis?
Regarding the abdominal pain, you mean so, right?
No, considering acute limb ischemia,
Yeah.
there, what would
Yeah.
be your new diagnosis?
My new diagnosis would be critical limb ischemia.
No, mesenteric embolus, because
Ah,
mesenteric
regarding the abdominal pain, okay.
no,
Okay,
not
mesenteric.
from there embolus has been discharged and it has
Mm,
dislodged and it has caused acute limb ischemia, and this is
okay.
same yes embolus which has been dislodged from there. All right, please tell me, in order to save the limb, you've already told me you've done atrial duplex. What else do you think you can do?
As investigation, I can go with CT with contrast
CT
uh,
angiogram.
after, after taking the renal function test.
Yes.
And yeah,
Okay, what would be your plan of management?
Okay, this is a critically ill surgical patient, so I
Yes.
will manage him according to care of critically ill surgical patient, ABCD approach, assessment and management. I will correct the hypokalemia using potassium chloride 20 to 40 ml in 1 liter normal saline. And I will closely monitoring his, I will closely follow up the patient and continuous monitoring his ECG. And I will do a series of potassium levels. Then I will correct his atrial fibrillation, first by correcting the underlying cause, which is most likely here is hypokalemia, as I started the management of hypokalemia. And then I will go for rate control using beta blocker or rhythm control using amiodarone. Then I will give anticoagulant. Anticoagulant, I can give unfractionated heparin, 80 international unit,
All right,
liter against
doctor.
sleep.
Can I
Yeah,
just ask you to stop here? Why have
okay,
you chosen unfractionated heparin
okay,
as a choice of your anticoagulant?
because I don't have view of the renal function test,
No, no,
so
no,
I can.
wait. You've already said that you will check the renal functions and then you'll ask for CT scan, CT abdomen with contrast. So just assume you've already checked renal function test, which turned out to be normal, and now
Okay,
you've done CT abdomen with contrast, and now you're giving which
because
anticoagulant?
it acts fast
Yes,
and
yes,
it
that
acts
is the
fast
reason.
and yes.
It can be given intravenous, and its
Okay.
mode of action is quicker. All
Yeah.
right. In order to prevent, now I'm just focusing on the acute ischemia. All right, you said you can give anticoagulant. What other measures can be done in order to save the limb?
Okay, the definitive management by surgical embolectomy or
Yes,
thrombolysis or
yes,
bypass or angioplasty. And
yes,
I have to go for fasciotomy in fear of compartment syndrome and in
right.
fear of reperfusion injury.
All right. So, what are you going to tell the family of the patient?
And I'm going to tell them that the patient have developed a sudden reduction in her lower limb circulation. That's why we need to transfer the patient, and unfortunately, she might lose her limb.
All right. So, what type of ambulance would you prefer to transfer this patient in?
Okay, I prefer air ambulance, but if it is not available, I will go with advanced life support ambulance with the blue light on. And it is is cardiopulmonary resuscitation set and a syringe pump containing cardioversion drugs like amiodarone.
All right. Okay. Then you are free to transfer your patient to us
Okay,
for
thank
further
you very
management.
much, doctor.
Thank you.